Assisted suicide, also known as euthanasia, is a deeply divisive and controversial topic that elicits strong emotions and moral dilemmas. On one side of the debate, proponents argue for the right of individuals to control their own deaths, especially when faced with unbearable suffering or terminal illness. They emphasize the importance of personal autonomy and the right to die with dignity. On the other side, opponents raise concerns about the ethical implications and potential abuse of assisted suicide, highlighting the sanctity of life and the potential for slippery slopes leading to involuntary euthanasia. In this discussion, we will examine arguments from both sides, seeking to understand the complexities and nuances of this contentious issue. Advocates of assisted suicide argue that it offers a compassionate and humane approach to end-of-life care. They maintain that terminally ill patients who are enduring immense pain and suffering should have the choice to die peacefully, surrounded by loved ones. These proponents emphasize the principle of individual autonomy, asserting that people have the right to exercise control over their own bodies and make decisions for their own lives. They argue that denying individuals the option of assisted suicide perpetuates unnecessary suffering and diminishes their dignity. Opponents of assisted suicide, however, express concerns about the ethical implications and potential dangers associated with its legalization. They argue that intentionally aiding in another person's death goes against the fundamental value placed on the sanctity of life. These opponents contend that legalizing assisted suicide could blur the line between mercy killing and involuntary euthanasia, putting vulnerable individuals at risk. They fear that this may eventually lead to a society where the value of a person's life is determined solely by their quality of life, potentially devaluing the lives of those who are frail or disabled. One of the concerns raised by opponents of assisted suicide is the potential for vulnerable individuals to be coerced or influenced into choosing death over palliative care. Critics argue that the power dynamics within families, healthcare systems, and society at large could exert undue pressure on individuals to opt for assisted suicide. They caution that financial constraints, emotional manipulation, or societal expectations may lead people to make a decision that they otherwise would not have chosen. Furthermore, they argue that investing resources into improving palliative care and end-of-life support would be a more ethical and compassionate approach, ensure that individuals receive the best possible care during their final days. Proponents of assisted suicide counter these concerns by asserting that robust safeguards can be implemented to protect against abuse and ensure that it remains voluntary choice. They propose strict eligibility criteria, requiring a clear diagnosis of a terminal illness and a prognosis of imminent death. They argue for a thorough evaluation process involving medical professionals, ethics committees, and legal experts to assess the validity of each request. By establishing these safeguards, they believe that the risk of abuse can be minimized, addressing the concerns raised by opponents, while allowing individuals untreatable suffering to have a compassionate alternative. Debate over assisted suicide often intertwines with perspectives on religion and spirituality. Many religious groups view life as sacred and believe that only a higher power has the authority to determine the timing and manner of death. They argue that choosing to end one's life interferes with the natural order and divine plan. From this standpoint, assisted suicide is seen as a violation of religious principles and a rejection of the sanctity of life. On the other hand, there are religious individuals and groups who interpret their faith in a way that allows for compassion and understanding, supporting the idea of assisted suicide as a humane response to suffering. Legalizing assisted suicide raises additional concerns related to the healthcare system and the role of medical professionals. Physicians take an oath to save lives and provide care, and some argue that assisting in the death of a patient contradicts this ethical obligation. They assert that the focus should be on improving palliative care, ensuring that individuals receive effective pain management and emotional support during their final stages of life. These opponents advocate for increased funding and resources dedicated to expanding palliative care services, allowing individuals to pass away naturally. In contrast, proponents of assisted suicide argue that physicians should have the autonomy to respect their patients' wishes and act in accordance with their best interests. They believe that medical professionals can play a compassionate role in assisting patients who are facing unbearable suffering. These supporters argue that by legalizing assisted suicide, physicians can be given clear guidelines and protocols to ensure that the process is conducted ethically, responsibly. They assert that allowing physicians to participate in assisted suicide expands their capacity to uphold patient-centered care, enabling them to relieve suffering, respect individual autonomy. As we navigate this contested terrain, it is vital to engage in open and respectful dialogue, recognizing the complexity of the issue and the profound implications it holds for individuals, families, and societies as a whole. The debate surrounding assisted suicide encompasses deeply rooted ethical, legal, and religious considerations. There is no easy answer, as both sides present compelling arguments that reflect their diverse values and beliefs. By exploring a variety of perspectives and understanding the underlying motivations, we can strive towards an informed and nuanced understanding of this complex matter.